Thank you very much, and thanks very much for inviting me. It's great to be here and great to be in person again. In fact, great to be here for the first ever in-person PPN Midlands event. How brilliant. I have some history in the Midlands, so I lived here for, both in the East and the West Midlands, to keep it fair, in my 20s, and I had a fantastic job when I lived in Birmingham, which was, I was called a ties and connections worker, and I worked for a housing association, and my job was to support adults with learning disabilities to form ties and connections in the community. And so to do this, I set off to a whole range of different sort of community activities, and I think I may be the only person who was simultaneously a member of the Birmingham Friends of the Earth, the Black Country Museum, and the West Midlands branch of the Elvis fan club. So it's great to be back, but I'm pleased to say I haven't bumped into any of my old Elvis mates. So what shall we do with the NHS long-term workforce plan? That's what I'm here to talk about. Well, you know, we have a lot of these sort of strategy documents. This may be the temptation. Here's a really big thing that's somehow landed in my inbox. Hit delete, or if you're analog-minded, head straight to the shredder. So I'm going to ask you to pause on that urge and have a think together about what can we do with this plan, because I think it's actually a very significant milestone and further step forward in our work and in developing and growing the psychological professions. So if we return to the mission for a moment, so Sunny's outlined the sort of vision that we developed. I think that kind of mission to extend and embed psychological practice and knowledge across the whole of health and care could really be summed up as a more psychological NHS. And so that's kind of the core mission, I think, that we can all join forces on and have made some commitments to in that sort of visioning process. And why do we want to do this? Well, it's very clearly what the public want more of. People, when asked, would prefer, for example, a talking therapy to medication by a ratio of about 3 to 1, where that's an option. There's great evidence for the effectiveness of all of these approaches across what our workforces offer. Offering more of it actually drives cost efficiencies in the system. So this isn't a nice to have, it's something that can really help us at this moment in the NHS's history. And yet, most of those who could benefit from a psychological way of working currently don't receive that. So this needs to change. But let's face it, it's a difficult time for the NHS, really difficult time for those who work in it, difficult time for those who are using it. So can this really be a time of opportunity? Well, I believe it can. And one of the reasons for that is that we have a sort of policy platform now that is unprecedented, I think, in terms of recognising the value and importance of psychological professions as part of the system. And so we've got a number of layers to this platform. We have the long-term plan, mental health implementation plan, the psychological professions workforce plan that Sunny's referred to, and now the NHS long-term workforce plan. And sitting there alongside this as well, we need to be aware of the major conditions strategy that's published its interim findings, which also will have significant implications, I think. So taken together, all of these plans really push forward on an expansion agenda. And the NHS long-term workforce plan pushes further than the previous modelling in terms of how much we need to grow our psychological professions workforce if we're going to transform the service according to some of the commitments that are being made in policy. And that commitment within the NHS long-term workforce plan is for something like another 150% growth on the psychological professions workforce from the baseline that's stated in the plan through to 2037. So massive further growth. So that's why I think this is a time of opportunity, notwithstanding, of course, all of the challenges that we've already started talking about. How does this all fit together? We've got all these multiple roles. How do they overlap? Where can they be deployed safely? How do we keep people? And all the rest of it. But I just wanted to sort of, I suppose, highlight some of the elements of the long-term workforce plan and why I think they are important. So Helen's touched on this already. The purpose of this is to set a kind of long-term strategic vision for workforce in the NHS. It was long heralded. Successive health secretaries promised that it was coming, I won't go into the drafting process. It was very painful, and at points we really didn't think anything would be published, and so we now have it published, which is a great step forward. It has also some concrete actions within it to be taken at different levels of the system, nationally, regionally, locally, and some funding attached. I have to say, though, it doesn't contain all of the concrete actions required to deliver on its ambition. So there's some work for us to do, and I think that's where there's a particular role for groups like the PPN to help bring people together and think about how can we implement this in a joined-up way. And 3 key strands to it, 3 sections to the plan, for anyone who hasn't read all 157 pages, I think it's 157. Train, retain and reform. Helen's touched on these. So train is about bringing people in, but doing so in a sort of diversified way. So using more apprenticeships, using more different ways of training, alternative routes. Not just thinking in the same tram lines. Retain being about keeping people in, but not just through nailing their feet to the floor, but through better support, careers options. So really important that we have senior role opportunities within all of our occupations, so you don't need to progress into a different sort of training in order to progress further in your career, although of course that is right for some. Flexibility about working patterns, increasingly it's sort of something that people are wanting and needing, and culture and leadership being right. Well, it's easy to say that, and that's obviously a massive topic in its own right, particularly when services are under enormous pressure. And reform is about new ways of working. Particularly big in this area, I think, is digital, and how digital will start to make an impact over the next 3, 4, 5, 10 years in the use of new technologies. So I'm going to focus on mental health for a moment, and of course psychological professionals don't just work in mental health, but a large portion of them do, so that's why this is worth particular focus. But many of these issues that are named here also apply across the piece. So the plan makes a commitment to training plans being formulated over a 3-year period. Now, this may sound just obvious that you should be doing this, but it hasn't been the case. So we've been successively working on 1-year funding cycles, which mean it's incredibly hard to plan sustainably for what your sort of training intakes might be at a university in 2 years, 3 years' time. What, as a service, you might need to be planning for placement capacity 3 years down the line. So the commitment is 3-year planning cycle. This is good. We need to see that come to fruition with 3-year funding cycles to back it up. It also commits to further iterations of the long-term workforce plan being developed every 2 years. So this isn't a static document, it's going to be a working document, that's the plan. Obviously we may see changes of government and everything over that time, so let's watch this space. But the intention is every 2 years, a refresh and update. And that's another opportunity for us, because the elements that aren't currently concrete about how do we do this for the psychological professions can perhaps become more concrete in future iterations. That's the aim. Okay, so for mental health, alongside primary and community services, the intention is to grow the workforce by 73% by 2037. That's a massive growth, and the model for the growth of mental health workforce is the largest demand growth of any pathway in the NHS. 4.4% growth per year for mental health. That was a real win for mental health to get that modelled in. I have to say though, that model isn't based on an assessment of future need. It's based on what has the growth in mental health been over the past 5 years, and let's extrapolate it forwards. So it's quite possible that we'll need more growth than that if we start looking at this around need. And of course, you know, vitally importantly, and again, easy to write down in words, but the work is to be done. The necessity of working with stakeholders across the system to build placement and supervision capacity. We can't do all of this sort of education growth without the placement and supervision capacity. We know that's already stretched, and you know, what's that going to look like when we're growing by another 157%? Okay, so just now to tease out the sort of elements for the psychological professions more broadly, so within mental health, but also beyond mental health. So the numbers for psychological professions in the plan, this is why I think it's an opportunity. 24 to 26,000 more posts in the next 14 years. Okay, so anyone have a guess how many psychological professions posts we have currently? To the nearest 5,000? Don't be shy. Everyone's far too worried about revealing themselves to be well tracked. I actually don't know the answer yet because we don't we don't have the results of the workforce census that we've conducted very recently. But we estimate that it's going to be knocking on for about 25,000. And if we go back to 2007, the year before IAPT was born, there were about 8,000 psychological professionals. So we're already on this massive growth trajectory, and here's a sort of need for huge further growth, roughly doubling where we think we are now. The plan specifies that this is across a range of different occupations: psychologists, psychological therapists, and psychological practitioners. And it also contains a commitment to continue what we've been doing, which is training about 5,000 psychological professionals per year over the past few years. So it contains that commitment for the next 3 years, including this year. This was also a win and wasn't a given. So it's really good to have that sort of buffer of the next 2 years where we know we can carry on doing roughly what we've been doing whilst we work out some of the detail around what else is needed. There's a paragraph in the plan which says, and psychological professionals are recognised as one of the areas where we might need to grow more than the plan says. So this leaves open a door for that sort of revised modelling to be conducted and to potentially grow more than that. Commitment to grow apprenticeships, and which is important for us because obviously we have the CAPS apprenticeship, we also have a PWP apprenticeship, we have family and systemic psychotherapist apprenticeship in development, and we expect there to be a CBT therapist apprenticeship also coming down the line. So this is a growing area for the psychological professions, and great that we can hook that onto the emphasis within the plan. And a really strong emphasis in the plan on retention, which is going to be important for us too, obviously. Okay, so we've got some raw materials that we can bring to all of this, and this is our current taxonomy, which has 20 occupations on it. We are talking about 21 because we're in close conversations with medical psychotherapy about also enabling them to occupy the best of both worlds, as we have with art, drama, and music therapists. So we can bring all of these roles to bear, and we're going to need all of them. So I think we've got to really get out of the headspace of competition and into the headspace of collaboration and integration so that we can make all of this work together. And that's not an easy task because some of these roles were developed without thinking about the whole. Many of them were. And so how do we now back engineer the sort of collaboration and integration into these? And we're commissioning loads of training. So this is the kind of commissions for education nationally from 22-23. Front runners here, PWPs. There was 1,600 commissions. I think about 1,500 places were filled. But all of these other roles as well being commissioned by NHS England. And this is what that growth looks like when you plot it out. So 8,000 or so psychological professionals in 2007, about 25,000 now, and heading for 50,000 by 2034. And some people look at that and think, well, that doesn't reflect my reality. You know, this isn't what's happening. Because there are, areas where it's still very hard to recruit or to retain. So if we look at this little section of this graph in terms of what's happening in the Midlands, this is applied psychologists, art, drama, and music therapists, psychological therapists, and child psychotherapists. And those are the categories that we can track. And you are growing. So the efforts are paying off. You can see here 2015 to 2023, really significant growth on that trajectory. Okay, but there's some real challenges, and we've started to touch on those, and I'm really looking forward to having more conversations about those challenges and digging into that today. Just to mention 3 of them, some of our pathways are starting from a really low baseline. So, you know, in some physical health services, there is no psychological practice in terms of psychological professionals. In adult community mental health, we have a very, very small amount of psychological therapy being offered. So we've got to sort of build from these very low baselines in some pathways. There's also really large demand growth for some pathways. So children and young people's mental health, we've seen huge growth in demand over the last year or two, post-COVID, which brings into question the modelling that's been done about the level of requirement for workforce. And in some areas, the expansion is running behind the ambition. So if we look at NHS talking therapies, we've been growing, but we've been consistently growing behind the curve of what has been modelled as required to deliver the talking therapies targets. So it's no wonder people feel stressed and under pressure. So what shall we do with the NHS long-term workforce plan? Well, I would suggest let's not hit delete straight away or head for the shredder. Nationally, what we want to do is now refresh our psychological professions workforce plan, which runs up to 2024. So in the next 6 months, we're going to be conducting some work to look at what does our next psychological professions workforce plan need to look like. And we're going to probably be modelling that on the sections of the NHS long-term workforce plan, so train, retain, reform. And that gives us an opportunity to update and make more comprehensive the education model in the plan. So we've got these sort of 2 years buffer, but what do we need beyond that? How do we need to sort of think about our education capacity in order to grow at this required rate? And it'll also need to focus on, and we'll need to focus heavily on career development. So we really want those senior roles to be more widely available across all of the different occupations, and career pathways that integrate more successfully. Regionally, what a great opportunity. You've got this fantastic network. So here's a real sort of significant opportunity for the PPN, I think. We're very interested in how PPNs can build on what they've done and develop schools of psychological professions in regions, which might hold together all of this sort of education quality, education pathway development, supervision capacity, and all of those sorts of elements. Bring together apprenticeships, how the new roles all fit together, etc. At system level, so we've got the integrated care boards now, integrated care systems. We've got to get into the conversations about workforce, and we're not in enough of them. So I know there's great work going on that in the Midlands. Let's do more of it and make it consistent. In every ICB, we're in the workforce conversation and starting to push our modelling that we're doing around the need and the opportunities and what the psychological professions have to offer to help solve those knotty challenges that workforce planners have. And at provider level, of course, we'll be wanting to focus on getting this right so that it's safe clinically and effective, and that the placement capacity is there and sustainable and supported, so that we can hit this level of expansion. So I hope you won't press delete. I hope that's been an interesting tour through, but I'm really looking forward to more conversations at the plenary. Thank you.